my YouTube channel. I am Ongira, currently a final year MBBS student from Southeast Asia's first medical college and East India's currently and very proudly the best medical college, Medical College Kolkata. And after procrastinating a lot, I am releasing this video about things you really should know about second and third year clinical postings. So the first thing first is you must really go to your clinical postings. Like many a times you might think that the seniors are not giving that much of importance to you, but actually because it's a very busy place, so you might think, but the thing is, if you show interest, if you show that you are very interested in the subject, then they will always help you, they will always teach you, because I have seen in my college at least that the seniors are extremely helpful. They will always teach you and always guide you in all the ways possible. So the next thing is, don't always have a tubular vision about the department you're going in. Suppose I went to my gynecological posting in the OT and I did not restrict myself to the gynecology part. I always asked the anesthetist, the professor or the whoever is there about what are the things they are doing, what the pharmacological preparations they are doing. I saw one lumbar puncture to be done at that point of time, so I asked about the procedure, how they are doing the landmarks, etc. Just ask and go and ask the matron, the nurse, everybody how they are preparing the OT. So you learn a lot of things just by going to a place which you really is very difficult to learn from the books, because there are a lot of books. So, and whenever you think that they are busy, you can really Google it. Like for the OT preparations, you can just Google it, or you can just see a PDF of your book at that very point of time, so that you will retain them better. The third thing is, the final year is very short for you to revise everything and very effectively. So in second and third year, try to know all the cases which you have to know. The more the better, but the things you have to know is about the history of some typical cases. Suppose CLD is a very important case, so you must always go and learn about what history, what clinical presentation is present, how to do the practical clinical examinations which you really know from your physiology knowledge. And on day 1, if you are going to the ward, on day 0 you should be knowing what case you are going to see and what clinical presentations is present, how to take the history. Just memorize them, just learn them up and go and practice them on your patient, and then ask your professor to come if he comes, and then whenever you present the case to him, he will be more than interested to teach you. He will be very enthusiastic, because and then whatever corrections he will do, you will remember them and retain the case much more longer. That's how you're going to revise and practice things. So I'll be sharing much more things, so for that you can subscribe my channel.